unfortunately, I don't know if there is an optimal approach to treating PH-like ALL. Many previous studies have shown that the patients with PH-like ALL really have worse outcomes. So they're more likely to have minimal residual disease at the end of induction therapy. They're more likely to have disease relapse and more likely to have a worse overall and event-free survival. So it's really, these patients really have a poor prognosis. We typically treat these patients similarly to how we treat other patients with B-cell ALL, where we look for, or where we treat the younger patients with a pediatric-based regimen and the older patients with either on a trial or with kind of standard chemotherapy approaches. But one tactic that some of the current ongoing clinical trials is using is to try to use targeted tyrosine kinase inhibitors to target the specific fusions and alterations that are seen in PH-like ALL. So for instance, there's a trial amongst the Children's Oncology group looking at either adding dasatinib to patients with Abl kinase alterations or adding ruxolitinib to patients with the JAK targetable lesions. We currently have a multi-center trial ongoing in younger adults, so ages 18 to 50, where we're using a pediatric-based approach, a pediatric-based chemotherapy backbone, and adding in ruxolitinib to try to target patients with JAK targetable lesions. And the hope is that by adding in these treatments that we can improve the outcomes. I think one of the challenges in PH-like ALL is deciding when and if to take these patients to allogeneic stem cell transplant, and I think that's still an ongoing question.